And now we'll move to the next slot, that is the industry address by Dr. Alben Sigamani, Chief Scientific Officer of Numen Health. Can we invite Mr. Dr. Sigamani to come on stage, please? Dr. Alben Sigamani, Chief Scientific Officer, Numen Health, to give his presentation, please.
Uh, Good afternoon. I just think I'll just take a little while for the slide thing to come up. I'll just quickly introduce myself. I'm Dr. Alben Sigamani. I'm a clinician scientist, and I've been working in the field of clinical research for a long time till teamed up with my colleagues here to found a company called Numen Health. And I've been requested to give an industry perspective about healthcare challenges or opportunities. I call it opportunities in India. And I have a short presentation. I think it's kind of just going to summarize what we've been hearing since morning. And pardon me if it has some repetition of what. Okay, the healthcare challenges or what I call opportunities in India, we can kind of divide them as the 5 A's. And I think we've kind of touched upon all of these points in the first panel discussion that we heard. It's all about awareness, access, the issues about absent healthcare workers, a big challenge with affordability, and most importantly, accountability. And I feel when we're looking at digital transformation and we're looking at technology, I think these 5 A's, which are currently challenges, can be converted into opportunities for technology development. Uh, we know the WHO defines what awareness is, but it summarizes basically if a person is able to use the knowledge to approach the right healthcare system, then we've achieved awareness. We've been talking about in the morning. We heard that we have the Google Doctor, which helps you with it. Now, it's also about not just giving the information to the person, but it's also giving them the skills to use that information, and then help that to manage their health. That's when we really say that you have created awareness, and I think that's the component where technology can help. It's not just feeding information, but it also needs to help them to use it correctly and help them to manage or make it easier for them to manage their health. When it comes to access, India still has a lot of gap. There's a good index to look at it, which is called as the Health Access Quality Index. We've been making a lot of improvements there. The gap was quite high. It's a score between 0 to 100. So if you're closer to 100, you have a much better health access. And if you're closer to 0, you have a poorer access. But India has a very varied distribution when you look at it from HAQ index aspect. There are certain states which are even over, the HAQ indexes are much higher than some of the developed countries of the world. And so because of this wide gap, there is a lot of opportunity. That's, I think, what we heard that in the morning also, Meghalaya having poor access to quality doctors, where this is where centers where we have maybe a little excess access to doctors or excess technology or excess doctors, that we can utilize them to bring technology to give access to these places. Um, Absence of healthcare workers, we do talk about it a lot from a doctor, nurse, and ratio perspective. But I would like to put healthcare force altogether. You know, yes, we do need a doctor to administer an acute treatment to a patient. But when it comes to chronic management, there's a lot that a non-medical or a non-doctor person can do. In fact, in the Western countries, they've already moved into that direction. Diabetes is no longer managed by doctors. It's managed by nurse practitioners who are trained to follow protocols. Because after that, it is just a matter of encouraging the patient to do the right things in the right way and picking up early symptoms and then flagging them to the doctor in case the doctor needs to intervene again. So I think the gap that we're looking at from an acute care management, yes, it still exists. But when it comes to chronic disease management, we have a huge workforce which we can integrate. I think there's a lot of discussion around this about bringing in the Ayush, alternative systems of healthcare, because a lot of patients still go to those healthcare workforce to get their chronic disease managed. So trying to block them away from the regular aspect of it will only keep this access to healthcare in a pathetic state. But if we actually are able to use technology where we can bridge these two gaps and we can bring in technology to standardize what anybody is offering from a chronic disease management perspective, then you can actually take leapfrog into building more access to everything. Now, we all talk about affordability. We all think that India is not spending enough on healthcare. Our patients are paying out of pocket, so we have poor infrastructure of healthcare. But if you really look at what is the expenditure that the Indian is doing, we are nowhere less. We are almost spending, an Indian spends expenditure is about 4% of the GDP. And the problem is that most of this is being spent by the patient. And sadly, the patient is spending it at almost his last few days or hours of his life. So there's a lot of focus that can be brought in from a primary healthcare perspective, preventive healthcare perspective. And this is where technology can play a big role, bringing in awareness, accessibility, and all these elements. So then affordability can be tackled in a different way. Like we were hearing in the morning, if we can get all the people who are in the rural centers or living in villages access to healthcare for which they don't have to travel all the way to cities and start crowding the hospitals here, then there will be much more, from an affordability perspective, you're able to kind of create more equitable solutions there. So I think it's about building models that can help increase our expenditure in preventive. Because if you look at this slide, we seem to be facing a huge crisis of expenditure happening in such a way that the families just become completely financially ruined. So I think converting that model and making that expenditure to be distributed. Don't spend all your money at the last few days. Try to distribute it in such a manner that you're able to manage your hypertension, manage your diabetes, and so that you don't land up in a hospital with a heart attack and a stroke. Accountability is definitely a challenge. When it comes to a large nation like ours, with so many different socio-cultural aspects of it and educational gaps, people can tend to take up activities which are like, where accountability becomes an issue. And I think this is one place where digital health records and creating audit trails on what you do helps bring in accountability. And if you build in protocols with checklists, which can easily be done through digitization or using technology, then we can actually start bridging the gap here. We don't have to worry about accountability. Everything that a person, like say for example, they're using antibiotics in a hospital. You want to bring in accountability to make sure that you're reducing your antimicrobial resistance. You can build from a technology perspective, you can see who is ordering what antibiotic. And if he's kind of deviating from the practice, you can always hold him responsible for it. So such kind of accountability, even as simple as antimicrobial resistance to a larger other problems, can be brought in when it comes to surgical interventions, any kind of procedures that we are doing. If there is a way that they are documented properly, then accountability automatically will start coming. You will have more people adhering to evidence-based practices. So on this platform is what, or I was the context, what we have built from Numen. So this is a little bit about what we are, what we are doing. So we are a digital health platform, and we are into continuity of care. So what we are doing is we are bridging the gap between the patient and the healthcare facility that starts widening since the time after the patient leaves the hospital. So we are trying to make sure that the patient gets continued care from that hospital from where he received a new lease of life. So we have patients who have had a heart attack or had a coronary angioplasty going home. We make sure that these patients are cared for and all their risk factors are taken care of, and we want to improve their outcomes. And we're bringing in all these elements that I talked about, creating awareness, accessibility to the doctor, bringing in accountability when it comes to implementation of evidence-based practices. And we're also trying to distribute the cost in such a manner the patients are taking their control on their lifestyle so that they don't end up spending more money in serious complications. And that's what Numen is trying to build. And we are currently expanding ourselves into the country. And thanks to APAC for giving us this opportunity a second time. I think we had a similar presentation at Delhi. So thanks, and it's wonderful being here and giving this talk. Thank you.
Thanks, Dr. Alben, for that insightful session. May I request Ms. Shangamitra Mohanty, co-founder of APAC News Network, to hand over a small token of appreciation to Dr. Alben. Thanks, Dr. Alben.